The real challenge isn't always the surgery, it's earning enough trust that someone is willing to follow your lead. That's why I always strive to establish my own standards. Hello, I'm Kyung Min, a specialist in facial contouring at Note Plastic Surgery. Even when patients share the same concern about a square jaw, a small change can enhance one person's appearance, while for another, it could erase what makes them unique. So, while surgical skills are important, the surgeon's judgment in deciding the surgery is crucial. The standards and differences in making that judgment aren't found in textbooks. It naturally develops by meeting as many patients as possible, listening to them, and performing surgeries. That's why this surgery is never something I do alone. I believe it's a surgery that the patient and I do together. It's a process of accurately understanding the patient's desired direction and using my medical knowledge and experience to create the best results together. That's the philosophy I envision and the approach I take to contouring surgery. Yes, the first role is that of an observer. In contouring surgery, the most important thing for me is understanding the patient as a person rather than just the face. Patients' concerns often go beyond simply disliking a feature. They're also thinking about how they want to look in photos, the impression they leave on others, and the qualities they never want to lose from their face. That's why I spend a lot of time on consultations. I observe everything, from what clothes they wear, what they say, their tone, makeup, and even which words they linger on. After observing for a long time, it's easier to create a more personalized surgical plan. So I try to listen and observe a lot. The second is trends. People rarely see their own faces objectively. So while others might not see it as significant, it appears very pronounced to them. In these cases, an objective third party is needed to evaluate the bigger picture and make a balanced judgment. I believe that's my role. I believe that carefully observing and understanding trends is also important for developing that perspective. But I don't want to just create trendy faces. I try to understand what kinds of faces people find beautiful today, what kind of presence remains timeless, and why certain faces feel attractive in this particular era, even if they are not perfect. I believe that if a surgeon's sense of beauty and perspective stop evolving, the results they produce can no longer reflect contemporary aesthetics. So, beyond just faces and appearances, I consistently engage in travel, exhibitions, and cultural activities to stay current. I believe contouring surgery is a procedure that changes a person's aura with a single choice. That's why I don't make decisions easily. I don't quickly become confident either. I spend a great deal of time considering where to strike the right balance between the changes a patient wants and the qualities I believe should be preserved. I aim to be a doctor who knows not just how much surgery to perform, but where and how to do it, and I plan to uphold these standards firmly at Note Plastic Surgery.